Hello and welcome. Today we are going to be discussing a really, I would say, unfortunate topic that unfortunately affects 1 in 3 adults every year. And it's not always the prettiest thing when we do this activity. And what is that activity, you say? We're going to be talking about falls. And in this episode with me, Dr. Jen and Aging Advantage, we're going to be talking about fall prevention specifically. So, things we're going to be covering again is 1 in 3 adults fall every year. Like, that's a pretty big number. And so, thus, something we need to talk about. We're going to be talking about the causes and then also some of the risk factors. We're going to also be discussing strategies for prevention because let's face it, if we can stay up and not on the floor, the up is much preferred. We don't want to be visiting the ground and falling if we don't have to. And a really important thing that we're going to be discussing too, so make sure you watch until the end, is going to be some different types of strategies that we can implement in our homes specifically. And just as you guys know, that I talk about you guys being out there in the wild, when you leave your house, but just different strategies that you can employ to really help to mitigate the risks of falling so that we're not being as much of a fall risk. So those are the things that we're going to kind of, again, be discussing today on this topic. And, and then ultimately, at the end as well, we're going to talk about really like how do we then implement some of those falling prevention protocols and ideas and tips and tricks that we're going to cover. So thank you so much for joining me today, wherever you're joining us from. And again, Jen with Aging Advantage. We are a nonprofit here in the St. Louis area. We serve the St. Louis and the surrounding area here. And our goal and our mission is to be able to provide you all with incredible educational opportunities for different kinds of challenges that you might face, like housing insecurity, food insecurity. Could also be, again, like isolation issues, health and safety issues like today. Helping you guys also to just in general, just kind of get out there, and be more resilient, and learn also tips and tricks too, to be more self-reliant and to do life more safely. And by safely, I try to educate you guys on, safety and just, again, doing healthy things, not just physically, but also emotionally and mentally as well. And we also sometimes, we'll talk about spiritual things too. So just really in like full, well-rounded, all the aspects of life. I really want you guys, like learning some good skills and also some, things that you can implement to really enhance your life and make sure that you're living life to the fullest and the most engaged. And again, in a healthy way as much as possible. So that is who we are at Aging Advantage. We work through grants and also donations. And again, this content is really, really important. And way more people need to hear about this than just here in our St. Louis area. So if you know someone that this would be helpful for, please, please, please share it with them, no matter wherever they happen to be. And definitely also like our Facebook and follow our Facebook feeds. And then also, like and subscribe too to our YouTube channel so that you don't miss important content like this that can literally be life-changing and super helpful for all of you when it comes out. So again, thank you for joining me today, and sit back, relax, get cozy, grab your drink, and let's get started today. Okay, so again, let's start with a number here that is going to be pretty fascinating, I think, for all of you. Again, we're going to look at that number in terms of One in three older adults fall every single year. And again, that is a pretty wild statistic when you think about it, honestly, if we're being real. Because again, that means that there are a lot of us that are literally hitting the ground and we shouldn't be. So that's what we're going to be talking about today. And again, all of us, and with that being said, about being the adults. So in the genre of what we're going to be discussing here, age 65 or older, one in three experience falls. And, if you look around the room and you think about that, that's a lot of people in your life. And that statistic means falls are not just rare or an unusual event. They're happening to people we know in our neighborhoods, in our families, and it's happening every single day. And yet they're often not really talked about. A lot of times, obviously, they're embarrassing. And a lot of people get really fearful and really stressed by them because for a lot of people, it's kind of a sign that something else might be going wrong. And some people are just kind of really in denial and just not ready mentally, emotionally, physically, whatever, to maybe even like face potentially the cause of what actually had them fall sometimes in the first place. And so again, they can feel a little bit of shame possibly even around falling, which is interesting. And, again, though it might be a sign of, somebody starting to have a little more weakness, etc., just know, like, if you fall, it's not necessarily, a sign of failure. And again, weakness from like a physical standpoint, literally your legs might not be as strong as they used to be. Maybe you have neuropathy. There's other issues and other reasons, right? That things can happen. But, again, I want you to just challenge yourself on this idea and this kind of concept from the very beginning, from the start here. Like, you're not a failure if you fall, and you shouldn't feel embarrassed or shame or guilt or any of the things. Again, falls are a medical issue and it's a safety issue. And again, they just happen sometimes. It has nothing to do with your character or you necessarily always like as a person. And falls, are the leading cause of injury among older adults. And the consequences can be so serious and really far reaching. And so, that's why I want to talk about this with you guys. We really have to uplift this topic and again, share this information so that you guys can be safe. And, we're talking about injuries that can happen like broken bones, hip fractures in particular. That's pretty common. We all hear about that. That can require surgery, a lot of pain, and long recovery periods. Also, head trauma as well, which can have, if you fall and you hit your head. So that can have lasting effects on the brain and brain function. And another call out from the medical perspective here on this whole brain trauma, head trauma, is again, a lot of people 65 and older are on Eliquis or some version of that that's going to be a blood thinner. What happens when you fall and you hit any part of your body for that matter, but especially you hit your head as well, you're at risk for internal bleeding that can happen, and create increased pressure and increase problems like around the brain. And that can be a really serious consequence. And that stuff doesn't necessarily always happen like immediately. Sometimes that can have a long, like a couple, that can have several hours, that can have several days, sometimes of an onset to fully have the symptoms come to full fruition. And so that's why some of these things, especially, can be dangerous. The other thing too, again, like if you fall, depending on what happens to you, and you have to go to the hospital, that can lead to long-term care, you needing to be in long-term care. Again, if you have something catastrophic happen, you have to be in the hospital and then we continuum of care into potentially long-term care instead of back into, your independent living, or your assisted living kind of scenarios that you were in before. So, unfortunately, again, falls can just really change the trajectory of your independence And that is what I hate for you guys, to have to experience. Like, oh my goodness, if you don't have to go through it, don't. That's why we're going to go through this. I'd rather have you guys, instead of trying to rush and hurry along, or again, just stop, pause, go ask someone else. Hey, can you help me reach this thing on this top cabinet, instead of trying to climb on the ladder yourself? Yes, it might take an extra 15 minutes or 20 minutes or 2 hours for that person to get home, or that person to be able to get over there. But if you don't need that thing immediately right that second, or even like a day or two, but take the extra time and just make sure you are safe. And again, sometimes just a single fall can be the event that fundamentally, again, is going to change someone's level of independence. And again, not ideal. But beyond the physical injuries too, there's another consequence that doesn't always get talked about. And this is just equally as huge, and that's the fear of falling. This can also be dramatically life altering for someone, because what happens from like the cadence standpoint is, once someone has fallen or come close to falling, they then will begin to sometimes like limit their activity out of fear. They stop walking as much. They stop, avoiding, they stop, getting out and about. Like you guys hear me say, like, you guys getting out there running around in the wild, right? out there in your communities, right? You stop doing those things. You stay home more. You start withdrawing from social activities. You become more isolated. You become more alone. And ironically, that reduced activity then, because you're not, if you don't use it, you lose it. So that reduced activity then is going to lead to muscle weakness and decreased balance then overall, which all those things are going to add up to actually increasing your risk of falling again, which is the exact thing that we're trying to avoid. So it becomes like a very difficult cycle then to break. Once we start involving, like I said, kind of that mental emotional fear, and then going into, it physically manifesting as us, like I said, withdrawing. And so that's why fall prevention, isn't really necessarily, going to be just about injury prevention. It's really going to be about helping to like preserve your confidence, really preserve your freedom, and the ability to be able to just be out there and live your life fully, again, like socially, doing the activities you want to be doing, going to the grocery store like how you did before, going to bingo, going to church, just doing the activities that you want to be doing. It's just so important. So, why do falls happen? Let's talk about that. So, understanding the causes and the risk factors is the first step toward prevention, because we know that, we know that basically, like, what contributes to falls, right? And when we know what contributes, especially for us, like in our own environments, right? With our own health issues, etc. Once we can identify those things that contributes to falls for us, we can then start to actually take targeted action to help prevent them as much as possible. And, the good news here is that most fall risk factors are identifiable and absolutely addressable. So let's walk through some of these most common ones here. So first one we're going to talk about is muscle weakness and balance problems. And they're really amongst the most significant contributors really to fall risk, because as we age, we're going to just normally and naturally, we're going to lose some muscle mass, muscle strength overall. So that process in fancy doctor word land is called sarcopenia. So again, what is sarcopenia? It's going to be the loss of some of our, just like muscle. So the muscle mass muscle strength, and all the things that go along with that. But one of the things that people don't understand and realize is when you have a decrease in muscle strength, okay, you're also going to typically have issues a little bit more with your balance and also your coordination because they can become less reliable. And the result then overall is you're going to feel a lot less stable on your feet. What can happen as well is from, just a consequence standpoint, is someone also then can become slower to catch themselves as well. Like if they trip, um, and so example of this would be, again, somebody who may be like with Parkinson's, for example, if they kind of have like a shuffling gait, so they're kind of like shuffling their feet along, etc., right? um the or maybe they're neuropathy, right? There may be some diabetic neuropathy or something like that, so they don't feel the bottom of their foot right every single time they step. And what can happen sometimes then is they don't pick their foot up all the way off the ground to clear the ground before they swing their foot through and they take a step next time. And so then what happens? Well, they trip. And so what occurs then, again, when you have like this less amount of muscle mass and all the things, not as good balance, not as good coordination, is that we then have a harder time, like when we do like potentially like trip, whether it's like, again, not picking up our foot right, or if like, let's say the terrain or the ground that we're trying to walk on maybe is like not flat, it's not perfectly flat, like there's a crack in the sidewalk, or the the flooring is a little like bumpy or something like that. There's a ramp you need to walk on, etc. But what happens then is when you kind of trip, we're a little bit slower to actually like catch ourselves with our other foot. And we're less able then to also, again, like I said, kind of navigate those uneven surfaces in a safe manner. And the good news here is that muscle strength and balance typically, can absolutely be improved at any age through regular exercise and some other, different kinds of, like, physical therapy stuff, or sometimes even like occupational therapy can help kind of get everything coordinated, especially for you, like in your own space, which we'll talk about shortly here. But another thing that is so, so, so key that I absolutely want to point out, and people, for whatever reason, again, I don't know if it's a pride thing, if it's an ego thing, if it's a embarrassment, if it's a shame, if it's I don't know what it is, but poor vision and impaired hearing. And those are going to be also significant risk factors. But a lot of people, like, sometimes it's like they just prolong getting the care and getting the diagnosis and getting the treatment that they need to be totally supported in these categories. And it is significant risk factors because visual changes are extremely common in older adults. So we've all heard of these words, but like, you can get you're typically going to get like cataracts for sure. Some people also get glaucoma. Macular degeneration is another one, just alongside of regular, visual changes. Like you just can't see as good, close up, as we all need like cheaters and readers for glasses, when we kind of hit middle age on, right? So we know we can't see as good. But then also far away, that also gets, worse as well. So just in terms of not even, beyond like regular visual changes per se, um, you then are going to have all these other potential complicating vision issues that can then occur. And these simple changes that I just mentioned, again, like your cataracts or glaucoma, macular degeneration, et cetera, and some of these things can really, really start to mess with your like depth perception. Okay. And it's going to affect then how accurately you're able to perceive your environment. And by that, what I'm meaning is, you can't really necessarily see if you can't, let's say, like this person in the picture here, that he's walking down the stairs. But if you can't see the step clearly, or you misjudge, again, a surface from a depth perception standpoint of how close it is to you, how far away it is, proximity to you, a fall can happen so quickly. Hearing, interestingly enough, is also going to play a role too. So, our inner ears are involved in our balance. And interestingly enough, too, here, and again, this is not talked about enough. So, literally public service announcement here. But again, your inner ear is going to be involved in your balance. And when you have hearing loss, it can subtly affect that, stability and kind of how, again, like how sounds and how everything is kind of perceived within your ear. So it can really kind of start to affect our stability and also kind of, again, like our just spatial awareness, because sometimes, again, like when you're walking or when you're stepping or when you're doing something like that, as strange as this sounds, like you don't ever think about hearing yourself when you're walking, right? And kind of like what, step, 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 like what pace you're kind of stepping at, right? But again, like if you can't hear that, sometimes, or you can't hear what's coming around you or coming towards you or something, and you need to move quickly, you need to pivot, you need to stop, you need to change directions in response to a sound that you're hearing. You're not as like agile, you're not as nimble as you used to be, that you once were, as we all know. But when we can't hear well, just like when we can't see well, then you don't have the ability necessarily, again, to be able to have that stability, to be able to, to move, or stop or change, directions as good, as you did before. So, please, 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 get your, vision checked, get your hearing checked, and make sure, you have those things, all, like how they need to be for you to be able to function well and be supported. Another thing that we're going to talk about here is going to be medications. And I'm telling you, on the doctor side here, this is huge. So huge. So many patients and people don't even necessarily realize that medications are a risk factor, because what happens is, again, some of the medications, they don't initially connect to falls, like for in somebody's mind. And even sometimes in providers, like the medical team, medical staff's mind. But the connection sometimes for some people is very real. So many common medications, like blood pressure medications, sleep aid medications, definitely anti-anxiety drugs, some antidepressants even, et cetera, et cetera. But I'm going to throw into here, too, as well. Like if somebody has, and this kind of can fall under chronic conditions, but like if somebody has diabetes or they have blood sugar issues, right? Um, Maybe they, took too much insulin or not enough, or whatever. Some of the dosing, can sometimes be wrong, but it can definitely cause dizziness, can cause lightheadedness. You can kind of feel like kind of brain foggy, but you can also then have some slower refluxes as well. And again, that whole like something's coming at you and you need to stop, you need to pivot, you need to move, you need to, react. You can't do that as well because you're just a little more slower and groggier, with certain medications when you're taking these. And a thing to note in this category as well, when you're taking multiple different kinds of medications, which, as many of you know, a lot of you are, and especially a lot of older adults are, what can happen is those combined effects. Again, like you might have the side effects from one medication, is kind of, like mild by itself. But sometimes when you couple this medication with that medication, then you can get, the combination of the two can give you these kind of, unstable feeling effects. And so, if you are noticing any of those kind of side effects, definitely talk to your doctor and talk to your pharmacist, because all of these things combined can absolutely compound to increasing your fall risk significantly, especially, again, like our lovely gentleman on the stairs here, navigating the stairs, especially when you take into account trying to go up or down stairs, or again, like up or down a ladder, or, doing something like that where you are going to have to navigate a height change for a prolonged period of time, like the stairs, up or down. It's going to be challenging for some people. Another thing is going to be environmental hazards. So environmental hazards are going to account for a large portion of falls, unfortunately. So what does that mean? So example of that is going to be like loose rugs, cluttered walkways, poor lighting in hallways and stairwells. Another huge one here is going to be like slippery bathroom floors, slippery kitchen floors. Um, or even, sometimes like if you have a mat outside, and it's rained or something, and for whatever reason it's kind of slippery, like concrete or the something is kind of slippery a little bit, that can also be an issue. Especially, for example, like if it is in your garage floor, on that concrete, where that concrete is like we call it like a smooth pour, right? So sometimes, yeah, when the concrete like that is like a smooth pour and it doesn't have like kind of a rough finish on top of it, that plus something wet is going to be, is going to equal fall sometimes, unfortunately, for some people. So again, like there's a lot of just kind of different physical conditions in our homes and again, out and about in the community that can absolutely contribute to an increase like fall risk and increased opportunities to potentially be an issue. And many of them, good news here, light at the end of the tunnel, is that many of them are really straightforward and easy to fix, which is good. So finally here, we're going to look at, chronic conditions. So we're going to look at things again, like arthritis, possibly like I talked about earlier, neuropathy. And what is neuropathy? Let's talk about that for a quick second. So neuropathy is again like kind of nerve damage, if you will, that causes a lot of times numbness or tingling sometimes again in your feet, can be your legs. Sometimes people can get like a neuropathy also in their, in their fingers, like their hands. You can get neuropathy, at any part of your body. But a really common one again is going to be in your legs and in your feet. And when it's in your legs and your feet, it 100% has the potential, again, to affect your stability, affect your gait, and your sensation in a way that can definitely increase your fall risk. And again, like we discussed, nerve damage can be from so many different things. Can be, again, for some people, um diabetes, like I said, can do it. They can also maybe have, again, something kind of like a Parkinson's, where they just can't feel as good. Other people potentially as well. I'm going to talk about veterans for a quick moment here. There are a large portion of the older veteran community, some of the people that were like exposed to Agent Orange, et cetera, like back in the day. Some of those people have been, diagnosed, with neuropathy in their, feet or their legs or whatever. Again, they can't feel as good in their feet or legs. So I'm just giving, again, and there's a lot of different things a lot of different conditions that can, cause neuropathy. But just to give you some, kind of some ideas here. But again, managing these conditions well as part of your overall health plan is really also, part of your fall prevention plan. So even again, like how like how we talked about like arthritis, right? So key because like if you have pain in your hip, you have pain in your knee, again, like maybe you even have like pain in your feet. And, when you try to walk, when you try to step, like it hurts. And then from a reflex standpoint, you go to step down and then you have pain. Well, then what does your body want to do? It wants to move away from the pain. So then you try to like pick your foot up really quick or pick your leg up really quick. And again, it can create a kind of an unstable environment. So, the important thing to realize here is going to be the fact that, many, many, many older adults are really going to be struggling, like I said, with trying not to fall, if you will, um, for, a fair amount of time. And it's not necessarily, again, that people, in their homes are the only ones experiencing this. Like, obviously, again, like out in the wild, when you guys are out there, doing your thing, you're also, going to be experiencing this, right? And so I want you to think about even as well, like when you're at the grocery store, for example. And again, sometimes like those floors are really slick, especially if they're wet, or you're out shopping, or maybe you're at like a community center or something like that, or again, like you're somewhere that has rugs and all the things. You really have to kind of pay attention to some of these things and navigate some of these different things, because it's unfortunately, all risks that you just kind of need to pay attention to. And it's not, unusual, again, for people to fall. So we kind of have to look at how do we mitigate these things, one challenge at a time, one strategy of prevention at a time, and then how do we kind of implement some of these different strategies that we can learn. And so that's where on the part two of this, we're going to be going over like some comprehensive, proactive, like planning solutions that you guys can put in place to really start navigating through some of this fall prevention a little bit more. So, thank you all for joining me, and I will see you guys on the second part. Take care of yourselves and each other. We'll see you soon. Thanks.